My name's Rhoda O. I'm a professor at Boston University. I'm a neuropsychologist, so I'm not necessarily focused on dementia and Alzheimer's disease per se, but I'm really interested in the whole spectrum of cognitive aging from normal to not. So one of the things that really drives sort of my interest is how do you actually assess people's cognition accurately? So what happens is in the field of neuropsychology, what we typically do is we give people these cognitive tests. And these tests might be tell you a story, ask you to tell it back to me, have you look at some pictures and name it, ask you to do some written responses to different questions I might give you. But fundamentally, what I worry about is that there's lots of things that could affect your cognitive capabilities. So one of my goals is actually to figure out, how do I do a cognitive assessment without testing you? So it turns out that everything we do through our brain. So you're always reflecting your cognitive capabilities. I want to figure out, is there a way in which I can use technology to track all these different behaviors, and then through really analytic capabilities, start to derive what your cognitive capabilities are rather than testing them. So I want to infer cognition rather than test cognition. And I think that that's how we're going to get to it accurately. And that's why that's taken me down a path of really thinking about what are the tools out there that allow me to do that. One of the things I've been doing is building this brain health monitoring platform, which is actually a combination of different technologies. I think that one of the things that we tend to do, particularly in research, is we tend to try to isolate, and we try to focus on one thing. And what I try to do is say, look, you know what? Our brain's pretty complicated. And I think that we need to embrace that complexity. And rather than isolate, I think we actually need to capture the richness, the comprehensiveness of it. And then I think that through sort of data science, artificial intelligence, advanced analytic capabilities, start to pull that out. So that's sort of my strategy. So I could be Fitbit, it could be a smartphone app, could be Alexa. It's likely going to be a combination of all of these things. It's not. I'm very interested in just tracking people's natural behaviors. So I have probably 2 additional goals in this. So one of the things is I'm very cognizant of the fact that I am not going to make these discoveries. So what I just talked about in terms of being able to infer cognition, I can enable that possibility, but then I need to share that data. And I need to share it broadly with the scientific community because they're going to figure that out for me. I'm not going to figure it out. So data sharing for me is a very big component of how I go forward. So that's one thing. And then the second thing is I think that the technologies today aren't going to be sufficient. So a lot of the technologies that we use are what we call active engagement technologies. So it is using a smartphone application. It is, putting on, entering, inputting, downloading, recharging, etc. And that's because most health technologies are really built with the idea of a patient. And what I'm really interested, because I'm not just about disease, I'm interested in people's cognitive health. Again, normal all the way to disease. And so how do you get people to want to monitor their behaviors on an ongoing basis when there's nothing wrong with them? And so what we really have to do is we have to get to technologies that collect the data in the background without you having to do anything. So, we call these sort of passive engagement or ambient technologies. And that's where I think the future is. So a lot of my work is actually, on the one hand, collecting what we do know and we can understand today, but also collecting additional data on top of it that will allow us to get to that future vision.